Hello everyone. Today we're going to discuss the topic drugs for hyperlipidemia. So let's get started. Before we delve into the classification of drugs, let's briefly discuss hyperlipidemia and its risk factors. Hyperlipidemia, as you may know, is a condition characterized by elevated levels of lipids in the blood, such as cholesterol and triglycerides. Hyperlipidemia is a common condition that can lead to serious health issues like heart diseases. Risk factors include a sedentary lifestyle, poor diet, smoking, and genetics. The classification of drugs are as follows. First off, we have statins. They're the first line medications for hyperlipidemia. Examples include atorvastatin, rosuvastatin, and simvastatin. They inhibit the HMG-CoA reductase enzyme, which converts HMG-CoA to mevalonic acid, thus depleting the synthesis of endogenous cholesterol. It is used to treat primary hyperlipidemia with increased levels of LDL and cholesterol, and is also used to treat secondary hyperlipidemia due to diabetes or nephrotic syndrome. The adverse effects include myopathy, liver dysfunction. Sleep disturbances are specifically caused by lovastatin and simvastatin as they cross the blood brain barrier. For drug interactions, statins should not be combined with cyclosporin, erythromycin, and azoles as they inhibit the metabolism of statins, causing increased blood levels of statins, leading to increased incidence of myopathy. Next, we have bile acid binding resins. Examples include cholestyramine, cholesterol, and cholesevelam. Bile acid binding resins are non-absorbable anion exchange resins. They make complex with negatively charged bile acids in the small intestines and get excreted through the feces, preventing the bile acids from returning back to the liver by enterohepatic circulation, thus decreasing the absorption of dietary fat. It is used to treat primary hypercholesterolemias and is taken orally with water before meals and is also used to relieve itching in patients suffering with cholestasis and bile salt accumulation. Adverse effects include constipation and exacerbation of pre-existing hemorrhoids and GIT distress. Next, we'll discuss inhibitors of intestinal absorption of cholesterol, which mainly include ezetimibe. These drugs inhibit Niemann-Pick C1 protein, which is an intestinal brush border transporter involved in the absorption of cholesterol, leading to reduced intestinal absorption of cholesterol. It is used to lower LDL cholesterols in hypercholesterolemia, and the adverse effects include GIT distress. Next, we have fibrates, whose examples are gemfibrozil, fenofibrate, and bezafibrate. The mechanism of action of fibrates involve interacting with specific receptors in the liver and influencing lipid metabolism. Fibrates mainly act by activating PPAR alpha, which is a nuclear receptor present in the liver that regulates the expression of genes involved in lipid metabolism. By activating PPAR alpha, fibrates increase the activity of lipoprotein lipase. Lipoprotein lipase is an enzyme that breaks down triglycerides in circulating lipoproteins. This leads to a reduction in triglyceride levels in the blood. Fibrates can also inhibit the synthesis of VLDL in the liver. As VLDL is a precursor of LDL, this inhibition leads to a decrease in LDL cholesterol levels. Fibrates can increase the production of high density lipoprotein, often referred to as good cholesterol. HDL helps transport excessive cholesterol from peripheral tissues back to the liver for excretion, promoting a healthier lipid profile. It is used to treat type 3 hyperlipoproteinemia and severe hypertriglyceridemia. Adverse effects include myopathy, GIT distress, increased blood levels of aminotransferases or alkaline phosphatase, and lastly, increase in the risk of gallstones. One thing to remember is fibrates are contraindicated in pregnancy. Lastly, we have inhibitor of lipolysis and VLDL secretion from adipose tissue, whose example is nicotinic acid or niacin. Nicotinic acid stimulates a certain G protein coupled receptor on adipose tissue, which decreases hormone sensitive lipase activity in adipocytes, leading to reduced peripheral tissue triglycerides catabolism, resulting in decreased flux of free fatty acid to the liver. It is used to treat hypertriglyceridemias, and the adverse effects include cutaneous hot flushing and pruritus, and this is due to the release of prostaglandins D2 and E2 within the skin. Other adverse effects are hyperuricemia, impaired insulin sensitivity, and hepatotoxicity. Combination therapies for hyperlipidemia involve using two or more different classes of medication simultaneously to achieve better lipid control. These therapies are typically considered when single drug treatment fails to reach the desired lipid targets or when a person has multiple lipid abnormalities that cannot be adequately managed with a single medication. First off, statin combination therapies. As we know, statins is the first line drugs for managing hyperlipidemia. So when statins alone are not sufficient to achieve target lipid levels, they can be combined with other lipid lowering agents. Common combinations include statins with ezetimibe or niacin. This approach allows for complementary mechanisms of action to reduce LDL cholesterol more effectively. Next, fibrate-statin combinations are used in certain situations when a person has both elevated triglycerides and high LDL cholesterol levels. This combination addresses both lipid abnormalities, reducing triglycerides and LDL cholesterol while potentially raising HDL cholesterol levels. Furthermore, resin combination therapies, where bile acid binding resins can be combined with statins or other lipid lowering agents to achieve more substantial reductions in LDL cholesterol levels. Lastly, PCSK9 inhibitors. These are a newer class of drugs that significantly lower LDL cholesterol. When needed, they can be combined with statins to further enhance LDL cholesterol reduction, especially in patients with severe hypercholesterolemia. If you found this video helpful, give it a thumbs up, subscribe to our channel, and don't forget to hit the notification bell. Thank you for watching, and we'll see you in the next video.